Hello, folks. Welcome to 2022 and another year of Inside the Marble Palace with some old faces and some new ones. I'm Murray Mandrick. That would be the old face. I'm the political columnist with the Regina Leader Post. First, to introduce our new face, Jeremy Symes, our new political reporter for the Regina Leader Post. Welcome aboard, Jeremy.
Yes, thanks for having me. Appreciate it.
You betcha. Well, thank you for joining us. And can I call you an old face, Phil?
You can call me whatever you want.
No, you don't want me to do that. Phil Tagg for the Star Phoenix, who is a columnist, a reporter, and has done some brilliant work both on politics and on COVID of late. Thanks for so much, Phil. I really want to get into some of the things you've been doing in terms of the unified grassroots, because I think that there's some relevance to what's going on politically and what's going on in terms of COVID. But let's start out with today's news, because we just finished a press conference with Chief Medical Health Officer Dr. Sask Shahab and with Premier Scott Moe updating us on COVID and the new direction. Well, Jeremy, I'll let you start out. What is that new direction? There really wasn't much there that was new, an awful lot that seemed a little bit old in terms of how to address the rising Omicron cases.
Right. I guess the new direction, or the direction the government wants us to take, is to, like Premier Scott Moe said, trust ourselves in terms of going to gather and things like that. I was kind of pressed and asked about gathering limits and why we're not doing that. And he's kind of defending his position why the government won't do that. He was pointing to other jurisdictions, saying, listen, they have still some Delta cases, and that's why you're seeing more problems there. That's not what we're having here in Saskatchewan. So in a way, we're not going to be doing more gathering limits. But at the same time, we have our Chief Medical Health Officer saying, you really should, not gather. You should keep your bubble small. So you're seeing those, I guess, conflicting messages between the two. And I think that kind of stood out from the press conference today.
And I guess masking is going to go on in terms of what news value is out of this press conference this morning until February 28th, yes. I believe, if I remember correctly. And in terms of the other restrictions, such as they are in terms of isolation and everything else, they're to stay in place. Am I right about that, Jeremy?
You are right, yes. So we're going to stick to the masking until kind of late February there, and the proof of vaccination is still going to be in effect till then. So there are those measures in place that the government likes to point to that are still in effect and that we're all participating in.
Phil, one of the things that's puzzling us as journalists, puzzling maybe a lot in the public, is why we are not proceeding with other more restrictions or reinstatement of some of the restrictions that we had, because I believe the Premier rejected even social distancing or relatively minor things related to crowd gathering size or recommendations, as Jeremy said, related to household gathering size that Dr. Shahab has recommended. A puzzling thing to me that I saw today was the Premier talking about him not being sure that restrictions are working elsewhere in the country, at least in terms of caseloads, and being quite pleased with the fact that we haven't seen a huge surge in at this point in hospitalizations. Can you tell us what's going on right now from what you've seen in Saskatchewan in terms of the Omicron numbers, and maybe, if you can, in broad strokes, compare that to what's gone on in other provinces, so people can get a little bit more perspective of where we're at right now?
Yeah, well, I think the first thing to note is that as was said at the news conference, a lot of the numbers we're seeing are not really accurate. I think Dr. Shahab said last week we're only capturing about 40% of Omicron cases. Now he lowered that to 20 to 30 and said maybe as low as 10%. So of course these numbers could be a lot higher. One other thing that they announced today is that they're further restricting who should go for PCR tests to people who have serious symptoms and are immunocompromised or have some sort of underlying issue that could make COVID worse. That's a kind of a dicey area. Like how are you supposed to diagnose your symptoms, whether they're severe or mild? And so, but in theory, if people follow it, it could lead to even lower potential numbers. The reality is we don't really know whether with the other restrictions that have been imposed elsewhere are working or not. They could have like sky high numbers that would have been even higher were there not restrictions imposed, right? We don't really know that. This Omicron came on so fast and so furious that it's tough to sort of gauge the response. And of course, you're talking to someone from a city that was potentially seen as a home for Winnipeg Jets games because nowhere else in Canada could you play to a full house. Well, we have a Saskatchewan Rush game on Friday in the same venue, Sask Center, that could seat up to 15,000 people. No restrictions there, no action by the city taken, even though we reached the city hall's critical level this week. Kind of like, okay, we're just going to sit back and not do anything. So, it sort of suggests that everyone else is wrong, that, restricting these large gatherings, putting any restrictions at all, like even say, you have to operate at half capacity at Sask Center. It's essentially saying, like I asked a question last year, what do you think that everyone else doesn't? It seems to be saying, yeah, they know something that someone else doesn't, even as they're preparing for a surge in hospitalizations.
I'm going to ask Jeremy about that surge in a moment, but you touched on something that I'm kind of curious about, because it's been an ongoing theme throughout this whole entire pandemic, at least since I think May 2020 start of reopening, and that is the cities being in pretty sharp contrast with the provincial messaging in terms of Omicron. Where do you see that being a little bit problematic, specifically in Saskatoon? There's huge surges in Regina and basically everywhere else right now. But as you mentioned, large gatherings at Rush games, large gatherings at junior hockey games, as there is in Regina. Where is Mayor Charlie Clark seeing that is a bit of a concern right now? And how have they generally reacted to the Omicron surge in contrast to the provincial government and what the Saskatchewan Party government is sort of recommending?
I frankly don't see much difference right now. I mean, I know it was very different in the fall, and it's probably surprising to a bunch of people that the same city council that tried to impose its own gathering restrictions, I mean, they came up in the fall also, they came up with this threat level where they had 4 levels of threat. Well, it was well publicized. They reached the critical level last week. They had a meeting on Monday and decided, well, we're not going to do anything in response to it. So it's difficult to see that the city is being more proactive this time. They could have taken, fairly minor steps like closing. I mean, it's major to the people who are impacted, right? But fairly minor steps like closing City Hall and closing recreation centers. They chose to do none of that, presumably because, what they were told by health experts and city administration is that, rec centers are not a big source of spread, and that the Omicron is expected to spike and fall, and cases are expected to fall rapidly. And as I made a point in my call, and that will run tomorrow, we don't know what Omicron is going to do in a jurisdiction where there's no restrictions whatsoever on it. So we're a little bit different than everyone else. So I'm sure a lot of people will find it surprising that they set this. And by the way, the thresholds to reach the critical level weren't just surpassed. As with all the case levels and all the metrics used, they were smashed. I mean, they were left in like I think in Saskatoon yesterday, the positivity rate was 39%, which is even higher than the 29% provincially. So, yeah, so it's interesting to see that at this stage anyway, they aren't doing much different than the province is doing.
Omicron's really the Gretzky of record breakings, isn't it? It's like the numbers are just off the charts in terms of everything else. In relation to that surge capacity, I don't want to leave it without sort of exploring all these things, because I think, Jeremy, that's where you were talking about where the public might be seeing a little bit of contradiction between various aspects of Premier Moe's messaging in particular. Now, he's basically saying that we're doing the right things and we're not seeing the hospitalizations at this point, and we're not seeing the caseloads, et cetera, and being rather optimistic about the hospitalizations. Yet there was an underpinning to this whole press conference, I think, from both the Premier and Dr. Shahab, related to the concern that we might be seeing a huge number of hospitalizations. I tried to get a number out of them in terms of what they think that number could be, and I don't think it was terribly effective in terms of the press conference. But what are they saying, Jeremy, specifically about their plans for a surge, and how might that contradict with other things they said in the press conference in relation to the underpinning message that they are in the right direction, that there's no need for restrictions?
Right. So in terms of hospitalizations and planning for that, they are going to be releasing details tomorrow, which will be January 13th, just about what their surge plans are for the healthcare system. And I think just all provincial employees in general, I'm thinking schools as well. And so it looks like they're going to be laying out scenarios about, okay, if we reach this level, what does this, how do we, if this many people can't work, what are we going to do to make it still effective and possible and keep our systems running, these essential services that we have. So they are still going to be planning something, I guess, in that front. In terms of hospitalizations, I know Dr. Shahab did mention they're looking at 3 scenarios right now. There's the optimistic scenario where they're thinking, okay, it's going to be lower than Delta. We're not going to see as severe as that. Number 2 is possibly more hospitalizations in the acute setting, but possibly less people staying in hospital and ICU and all of that. And then there's also the third option where we might see more ICUs as well. So yeah, lots of scenarios, I guess, and lots of, we'll see what happens. But yes, they are planning for those scenarios, I suppose. And we're also seeing other businesses and essential services across the province doing their own contingency planning and just kind of preparing for staff shortages if people are sick and that sort of thing.
I'd also like to quickly
point
out that the one thing they never talk about anymore is deaths, right? And we are seeing, you know, that's, well, I wouldn't say arguably, obviously that's the most important metric. And we've had a run here where we've had about a week, 5 days with no deaths, which is really good. But since they stopped talking about it, it's you know, we are seeing them rise elsewhere in the country, and you know, along with ICU admissions and hospitalizations. So is there reason to believe that that's not going to happen here? You know, when you talk about hospitalizations, well, you know, that's a lagging statistic. So is deaths. That lags even further beyond hospitalizations and ICU admissions. So it's something to keep in mind when we're talking about this. We're talking about people's lives as well.
I'm always fascinated with whom Moe is talking to, who Premier Moe is talking to when he is addressing us. These press conferences are obviously for the public at large, and he knows that and understands that. But his underpinning for everything he says tends to be, and I'll get you to speak about this briefly, Jeremy, in terms of his opening remarks, because they set a tone to me that of one that he's been trying to sell for a while now, or at least ever since he decided that we're not going to have any more restrictions or lockdowns, and that is, it's time to get on with life. It's time for businesses to carry on. Who was he referring to, and what was he in general saying about this? Because I think this sort of leads to sort of some of the political drivers in terms of this whole question. Can you just sort of refresh us in terms of what he said in that opening sequence?
Yeah, sure. I might have to double check on my notes on that one, sorry. But yeah, I mean, he's kind of talking about, there is that sense of kind of getting on with it, also putting a lot of the responsibility on people and for them to make their own decisions, I think. And so in my sense, he's probably weighing a lot of different political factions and whatnot when he's making those remarks.
That does beg the question, Phil, as to who is influencing the Premier right now. And I can't help but feel that Unified Grassroots and Nadine Ness is living a bit rent-free inside Premier Scott Moe's head as an influencer. They have been changing their approach in terms of how they're doing business right now. Can you speak to that, and maybe whether this is indeed having some influence on the overall conversation related to COVID-19?
Yeah, well, I'm not sure that affiliating yourself with Unified Grassroots comes without a price. Period. If you look at the NDP poll, they of course are losing ground in Regina and Saskatoon to the NDP, and losing some ground in rural areas to the Buffalo Party. So it's, you could see the different tugs on the Saskatchewan Party, right? There's people obviously who don't believe there should be any restrictions whatsoever, and there's people who believe that you should have quite severe restrictions right now. Unified Grassroots is an interesting group, and I'll give them credit for when they appeared in September and immediately challenged the proof of vaccination system. They've tried really hard to make sure that they don't look like the worst of the conspiracy theorists. They've stressed that they're not against vaccines; they're just for choice. They're against vaccine mandates and discrimination, and they're for unity and love and all that stuff. But if you take a closer look at them, the day after pediatric vaccines were approved in November, they had a candlelight vigil. Which, of course, why would you have a candlelight vigil unless you believed all of the misinformation out there about its effects on children? And interestingly enough, they asked people not to bring signs to that vigil. Like, what sort of vigil says don't bring signs? And why would you ask people not to bring signs unless you were afraid of what they were going to say? But they take a lot of credit. Their posts on Facebook suggest they have a lot of influence on Moe. They apparently just put out a video. They haven't released it yet, but it features Dr. Francis Christian. He's a former University of Saskatchewan surgery professor who was stripped of his duties with the SHA because he was, spouting a lot of misinformation about the vaccine. And so, I mean, the more they stay out there and try to be relevant, the more obvious it is who they are. And I think it is appropriate to call them an anti-vax group. Like, how else could you classify this group? They don't like the term, but just because they don't like the term doesn't mean it doesn't fit.
Well, what I find interesting, and this is the question I'm going to put to you, Phil, is that there is influence out there, whether this group is as influential as it loves to think itself is, because there's nothing more it likes to talk about than itself. But I honestly don't know if it's actually really that influential. What is influential is a train that they've hopped on, and I don't know which car everybody sits in that particular train, but it's one that's progressively moving forward, and I would argue even faster these days towards an end to this pandemic, towards an end to restrictions, towards an end to everything else. And I think what's hurting Moe as much as those on his left that basically say we're not doing enough to prevent whatever that we should be preventing in Omicron, be it hospitalizations, deaths, etc. I think he's having an equal political problem from those on his right or the right that are basically saying we need to end this. Are you seeing that in terms of the political landscape right now, and sort of identifying is sort of the reality for him right now, Phil?
Yeah, well, you figure the people who in that poll are parking themselves with the Buffalo Party. Well, the Buffalo Party is a complete mess, right? They ousted the only leader they've ever had and are not going to allow him to run to be the permanent leader. Now, that's fairly common not to allow an interim leader to run for permanent leader, but kind of the way they did it is really kind of shadowy, and it's for a group that also claimed to be grassroots. It's kind of, but I think it's kind of seems to be operating by an elite group that's in control of it now. But I think people who support the Buffalo Party have just their general philosophy has been not to overly impose restrictions during the pandemic. So I think that's kind of telling. There is that, and it's a rural urban split, right? I mean, there's probably very minimal support for the Buffalo Party in the cities, and it's a growing influence. And that's the paradox, or that's what conservative governments always have to face, right? Is whether they're going to not, when you try to, the Saskatchewan Party was a unification of the progressive conservatives and the liberals. Well, who's going to get more uncomfortable there? The right-wing conservatives or the left-wing liberals? And it appears that both of those things are kind of. I can't imagine that there's many true small L or large L liberals that would feel comfortable in the Saskatchewan Party right now. But you can also see that there's people who are too far right for the party as well.
Absolutely, and that brings us to the story that you did this week, Jeremy, on more ongoing polling. Now, to be clear, this polling was an NDP tag on to another poll, which, although scientifically accurate, or as scientifically accurate as online polls go, don't get me started in terms of how I generally feel about polls, but in terms of this poll, it is showing what a lot of other polls have shown, which is why I'm mildly interested in whether it was sponsored by the NDP or not. Angus Reid, other polling that we've seen and done, is showing a slip in Sask Party support for Moe in the cities, particularly in Saskatoon. But what I also found interesting was how strong the Buffalo Party was in rural areas. And in this case, the rural areas in this poll and this Citrix poll were pretty generally defined as north and south. But can you speak to the numbers in that poll and what they're seeing?
Yeah, sure. So in the rural areas, I think Sask Party still like heavily leading there, NDP trailing, and then you see Buffalo Party, I think at 8% and 6%, or 8% and 7%. And what was this kind of a sidebar, but what was really interesting to that when I was speaking with Jim Farney, the political science professor, he was like, I wouldn't be surprised if you would see a bit more than what you're seeing in that poll in terms of support for the Buffalo Party. He thinks there actually might be a bit more out there in terms of rural support, just because he was saying with online polls, those rural people, you don't really capture as much of them. But other than that, going back to Regina and Saskatoon in particular, the NDP poll found there was quite a big lead for them there. And NDP is saying that's because people are looking for leadership and they're looking for an alternative. And then in Regina, their lead is a bit more than the Sask Party, but according to Farney, he was saying we've kind of seen that NDP support in Regina before, but for him, Saskatoon really, really stood out.
Fascinating to me. To close out, Phil, how is this all playing out in terms of public policy we're seeing? Obviously, the biggest issue remains COVID-19 and its handling. We somewhat touched on how it may be influencing Premier Scott Moe and the Sask Party government in terms of not adding restrictions. But where else do you see the political landscape playing out in terms of influencing decisions and things that are happening within the framework of government?
Yeah, well, it's interesting, this sort of, I found it to be kind of an awkward news conference today where, we were both hearing that we're preparing for higher hospitalizations, but we're not really willing to take any action to try to stop the spread. And then the whole, you should trust yourselves message. I'm sure each side will see different things, right? The unified grassroots people, or the people who are against restrictions, will say, "Oh no, they're extending the laxest." And let's be honest, the laxest measures in Canada until the end of February. People on the other side will say, I can't believe, given the case numbers we're seeing, and that we know the case numbers are much, much higher, that we're not doing anything. So you can see where the tug of war is, and lots of people don't survive. Lots of conservative leaders of parties in Canada don't survive that. The Saskatchewan Party has done an excellent job for a long time of keeping all those at bay, and they appear to be tugging at it right now.
Well, it's fascinating to me because they celebrate their quarter-century anniversary in existence today, which is pretty young for a political party. Remarkable record in terms of how long they've actually been in government for the proportion of their existence, and in some ways rather remarkable how they still seem to have such a stranglehold on this province under Scott Moe, even with all this. But I guess this is things that we'll explore at other dates. This is all the time we have today for Inside the Marble Palace. Phil, Jeremy, thank you so much. Fine job as always. And we'll hope to see both of you guys soon.
Thanks for having me.
Yeah, thank you.